welcome everybody to this Ready Carlsbad Business Alliance virtual meeting. I'm Carolina Alban Stoughton, the Chamber Liaison for this committee, and I'm very excited that we can see each other and talk to each other and connect this way. It has been very important for the Chamber that all our members and all our committees stay connected the best way we can. So we are very grateful that you guys are here with us. Today we have some guest speakers, which we are very grateful to because they are truly working, 24/7 to make sure that we're all, always updated and that we have all the information we need to be safe. We are going to start today with David Harrison, who is the Assistant Director for Emergency Services at the City of Carlsbad. And just a little bit of housekeeping. If you have any questions, we're going to try to keep questions till the end. But if you do have them and you don't want to lose, forget your question, please feel free to send me a message via chat. You can put in parentheses who the question is for, and then at the end of the call, you'll make sure that I'll make sure to try to get as too many questions as I possibly can. And let's get started. If people also could mute themselves, that may help us, especially when more people join. Right now it's pretty manageable, but if we start seeing more people, I'd like for you guys to mute yourselves, and then then towards the end, maybe we can have a little networking also. So, okay, let's get started. David, thank you so much. And please let us know what's going on.
Okay, thank you, Carolina. Well, it's certainly a pleasure to be here. And I wanted to specifically thank the Chamber for Brett and Carolina and all your staff for persevering and making sure that we as a community are communicating during this COVID-19 outbreak. The Ready Carlsbad Business Alliance has been established for approximately 10 years now, and I think this has been one of the biggest challenges we've faced. We've seen wildfires and we've seen other types of incidents, but not something quite of this duration and community impact. And for the Chamber to step up like this to facilitate communications and interoperability across our community sectors is wonderful and terrific. Thank you so much, Brett. Likewise, I think I should say that it's absolutely fundamental to the city's response effort that I acknowledge where really responsibility lays for the structure that we have for effectively monitoring and responding to this outbreak. And it takes years of planning and resources to make sure that a city and a community is prepared to respond to something like this. And so city leadership, our elected officials, certainly council members and mayor have been a part of this process that far predates the start of this outbreak. We would not have had support for the Ready Carlsbad Business Alliance had it not been for our city leadership and elected officials. We wouldn't have the Emergency Operations Center that I'm speaking from if it wasn't for their leadership and their commitment of resources. And of course, they also approve all our operational plans, and we have strong plans. We had plans for pandemic developed through the dedication of resources and staff members that enabled us to develop these things. All of them just are indicative of the strong leadership and foresight that they've demonstrated over the years. And they've been involved on a daily basis through information sharing through the city's policy group. And I want to talk about our organizational structure. For this incident, it's similar to an organizational structure for any large-scale incident, similar to the organizational structure during the 2014 wildland fires, in that we have a policy group made up of city staff leadership headed by the city manager. The city manager is the director of emergency services, and I have had the fortune of being identified as the Assistant Director of Emergency Services since December of this past year. And so once again, it's this leadership focus on having a strong and robust organizational structure that has really facilitated the city's response. The policy group is made up of leadership from city departments, our deputy city managers, our public safety chiefs, and it's the policy group that has been developing a strategic direction for the elected officials' concurrence and daily briefings in and involvement in. The city manager has been the primary liaison between city staff preparations and the strategic direction provided by elected officials. Our policy group has been meeting telecommuting every day since about the 12th of March, maybe the 11th of March. We haven't missed a day, and we develop and execute the strategic objectives that I'm going to be talking about in a few minutes. So in terms of our organizational structure to this incident, it's the elected official leadership, it's our policy group of senior staff leadership, and then of course the city staff involvement through the Emergency Operations Center. You'll all recall that we talked a little bit about preparing for this type of outbreak at our previous Ready Carlsbad Business Alliance meetings. We, towards the end of January, heard that the World Health Organization had put out a public health emergency. The U.S. Health and Human Services Agency followed the next day with a nationwide public health emergency. The County of San Diego declared a public health and a local emergency mid-February, around Valentine's Day, and the City of Carlsbad declared a local proclamation of emergency on March 16th. But we have been meeting and involved in the preparing for the response and mitigation of this since, well, initially in January, but then in a evolving way through the month of February. We developed our initial emergency operation objectives in mid-February, and then, as I said, continuously since about March 12th. And so we're just about a month into this now. So let me just summarize briefly, and I know I have to keep this to 10 minutes, the type of work that we've been doing and our strategic structure for managing that work. We are organized in accordance with the state and federal incident command system, the standardized emergency management system in the state of California. And one of the principal concepts of NIMS and ICS is the concept of management by objective. So we have developed strategic objectives that the policy group deals with, and at the Emergency Operations Center level, and by the way, I'm sitting in the EOC right now, perhaps have a minute to kind of brief for at the end. We've developed 18 objectives so far. I'm not going to go through all 18, but I want to hit a couple of the fundamental ones that really are structuring the city's response to this outbreak. Objective one, the first objective, was to protect the health and safety of the community and city employees. And so the core mission of the city's public safety. Our Carlsbad Municipal Code talks about the prominent role of public safety. FEMA talks about the role of community welfare and local government's role in providing for community welfare. For our first strategic objective was to protect the health and safety of the community and employees. And we've done that in a number of ways. Talking about employees and city staff first, and not to dwell on it, is we are responsible for providing a safe working environment. And we have put practices and procedures in place to maintain that safe working environment. And I can talk a little bit about that if time permits. But more importantly for this audience, I want to talk about community safety. And foremost amongst the efforts that we've been involved in to ensure community safety has been what is our second objective, and that's the implementation and sustainment of the San Diego County Public Health Officers' health orders and amendments and the governor's order. It's these series of orders that have really established the structure of social distancing in our community, the 6-foot separation, and the recognition that the role that hand hygiene and respiratory hygiene play in mitigating the transmission of this disease. So you've seen the impacts of this objective. You've seen how public areas have closed, and beach areas and park areas and other common areas have closed to reduce the assembly of residents to mitigate the spread of this highly contagious disease. So those are the first two objectives. The second one was fascinating to be involved in, just incredible. On any given day, the city is performing many services and functions for the community. And so we have city functions that enable us to provide those services to the community. And our continuity of operations plan, which is a subset of the city's emergency operations plan, which by the way was approved by City Council in May of 2018, so it was current and relevant. All of our continuity of operations plans were also fairly recent and fully updated in February and by the end of February this year. So we had initially maybe 400 functions that the city performs on a daily basis. 334 of those functions were considered essential functions. And over the first 2 weeks or so of our activation, we, through telecommunicating and the revision of our understanding of what an essential function really is in this COVID-19 environment, we reduced the city's essential function total down to about 334. 149 of those are now being performed by telecommuting, and 155 of these essential functions are being performed by on-site staff. So on any given day, we have about 150 people, employees on staff, city staff on any given day. Yesterday's figure was 147. And through the work of David Graham, who you'll be hearing from lately, we have all this information displayed here in the EOC, so we know where our city staff is congregating within the facilities. Of course, in small numbers, less than 10, and I'm going to explain that and why our EOC is set up the way it is to ensure that we're implementing the social distancing rules. And then we have about, as I said, about 155 or so that are working on site, and another 30 that are hybrid functions. Some of the work needs to be performed on site, some of the work can be performed from home. So for the first 2 weeks or so, as we were implementing the health officers, we were also necking down the city essential functions to the COVID-19 definition of essential city functions, and ensuring that to the maximum degree possible, those functions that could be performed by telecommuting were being done by telecommuting. And that turned out to be a relatively smooth flowing process. All things considered, it was very well executed by the city. Other objectives included preparing for and responding to COVID-19 exposures in Carlsbad, keeping the community, staff, and leadership informed. I've already mentioned that Director of Emergency Services, Scott Chadwick, has been meeting with telecommuting and other ways. City leadership on a daily basis. We've been, the staff reports have been prepared, and David has been, I misspoke, Scott has been sharing with city leadership. They've been involved on a daily basis in how the city is responding to this incident, providing strategic direction. And you've seen, I think, the work and output of our city's communications department through the web pages, social media, and other digital, social, and traditional media formats. The immense of information that's being put out is really quite impressive. The city's webpage talks very specifically about Carlsbad issues associated with COVID-19. It in real time is relaying information from CDC and HHSA, the public health officer. It's a tremendous resource and a great credit to the communications department, and the public information officer staff here as a part of the Emergency Operations Center. And objective 7 is preparing for recovery. We've already started to do that. A big component of that is making sure that we are spending responsibly and we're tracking the city expenses and developing the initial damage estimate. So should money become available either through the state or the federal government for reimbursement for these expenses, that we're prepared to take advantage of that. We are monitoring staff illness and assessing the impact of that on essential functions. And we've been very fortunate in that respect so far. And we're also assessing COVID-19 actions and communications to maximize and ensure that we are providing equal access to the information that we're sharing to all members of our community. Certainly the elderly that are heavily impacted by this disease, those with other access or functional needs, American Sign Language videos and those types of things. So that's kind of the strategic framework of the Emergency Operations Center. I think I only have another minute or two. So I hope this is of some value to how we're doing this information management role and this resource management role in our Emergency Operations Center. So I'm just gonna say that staff is in another part of our building right now, so they're not contributing to the background noise. But you can see, and we talked about the Johns Hopkins map, and we are continuing to monitor the information that comes in there. We have a daily schedule of events. Our daily schedule of events in our EOC is integrated, is interoperable with the County Office of Emergency Services EOC and their Medical Operations Center. This is one of the tools that David Graham developed. It's a map that shows us where in the city our on-site staff employees are located, so we can maintain accountability, both of who's working where, the numbers where they're working. We can provide support and monitor health. We're also monitoring the health of the community on other apps, so that we know that our first responders are informed when they are responding to community calls for support on the type of environment that they're going into. David Graham also introduced the city to an application called Zen City. And in addition to our communications PIO staff developing a sense of the impact of the incident on the city through social media analysis, Zen City has been a very helpful tool in enabling us to understand the sentiment of city residents, community sectors, as we respond and work our way through this outbreak. Some of you are familiar with WebEOC. This is one of our principal ways of communicating with the county. Of course, we're monitoring all of the news updates from the governor and the public health officer. And this is just the main floor of the EOC. I'm walking into a second room. It's divided to make sure we're maintaining small groups, far less than 10 in our EOC actions. And this is the area, and some people are starting to scatter, but this is the area where both our liaison, our EOC liaison, is working. Maureen Jones Kirk, you know Marie because she was very involved in Ready Carlsbad during the 2014 Poinsettia fire, and our communications department and PIO staff. This is where the messaging is being developed. It's being displayed on the web pages and elsewhere. And although it's been reduced to one screen now, you can see where, let me get it, where we have been monitoring using a stoplight chart. Stoplight charts were introduced to our EOC by Bob Welty. He actually got an award for that. We stoplight charted just about everything we can. Green is good, red is bad, yellow means it needs some work. This is how we're monitoring the essential functions. And just lastly, I'm going to say this is how we're monitoring the other media outlets and social media. So I think I've far exceeded my time. I appreciate the opportunity to explain how the city is responding to the outbreak, the role that city elected officials and leadership have played, and I'll turn it back to you, Carolina. Carolina.
Thank you so much. For some reason, I'm not surprised that this is working so well for you guys. I'm still impressed every day about the work that you guys do. Thank you so much for that awesome behind the scenes. Really great. We've gotten some questions for you, David. I'll just bring them up at the end of the presentations. So I want to now introduce our Chief Innovation Officer, David Graham. and he's going to talk to us a little bit about the response when it comes to the impact that this pandemic is posing on our businesses. So very important for us. Look at that.
And here I am, just like that. Can everybody hear me just fine?
Yes.
All right.
You? Welcome.
Hi, I'm David Graham. I am the Chief Innovation Officer for the City of Carlsbad, the only such position in the entire region, which is fantastic. I started back in November of 2018, and I now head up the Office of Innovation and Economic Development, and have had a great opportunity to engage with many of you and with the Chamber in the tenure of being in this position. My job is really focused on working cross-departmentally to find innovative ways to improve city operations, to connect and use data to improve both city operations and our services to the public, and by and large, basically help do the things that government is traditionally not so good at doing, working together, engaging with the community, those sorts of things. And it's been great being in this position. Earlier this year, we added the economic development branch into my portfolio because really that connection with our companies, many of whom have great ideas about how to improve services. Carlsbad has a reputation for great and high quality customer service. And we really believe that that working together is the best way that we can create and continue to foster the amazing community that we have. And we see that every single day. Carlsbad is well known for people jumping in and making things happen, and a positive relationship between the city, our businesses, our residents, our visitors, and it's just been a joy to continue to be able to do that work. David has shared with you a few of the tools that we've been able to bring during this emergency, and we've been able to stand those up very quickly. There are a number of mapping functions that we've been able to provide. And a lot of this is sourced from issues and questions that we hear from all of you. And I'm going to have a quick little PowerPoint. I'm going to share my screen in just a second. But a few things we've been able to do. He shared some of the things that are internal to the EOC. But today we're launching a public-facing map that provides all the locations for food assistance for both families and individuals. So the locations that schools are providing for those that qualify for the free and reduced lunch program or other food assistance. One of the first things that we put up was actually a searchable GIS map for all of our restaurants who were having difficulty getting the information out that they were open for and legally operating for curbside takeout and for delivery. We have over 100 businesses that are on there, and the responses that we've gotten about that mapping project have been that has significantly increased the foot traffic to a lot of those locations. These are things that by connecting our residents and our businesses with data, with information, and making it easy to access, it's very possible that some of these restaurants may not have been able to survive and are still able to, with a skeleton staff or so, stay open, stay alive, and kind of weather the storm. So we're consistently trying to find ways to support the community, support city and city operations, and use technology and sometimes just normal analog tools to better improve the way that we do business and connect and work with the community. So with that, I am going to share my screen real quick. And here we go. All right. So we all know that right now we are in a significant time of economic uncertainty. Closures of non-essential businesses. The businesses with over 50 employees are required to send a letter called a WARN notice. The estimates from that are almost 4,000 layoffs. Food and beverage and hospitality, no surprise, have been the hardest hit. Sports design, innovation, and manufacturing are also being hit as well. And of course, the almost 4,000 layoffs, those are just for the larger businesses of 50 plus. we know that our small businesses are even more hit, and those numbers are much, much higher. Some of the things that have been happening around business community outreach include a survey of North County cities, and I want to thank Brett for being the one that helped put that together, that then the other North County cities and their chambers pushed out for the entire region. San Diego North EDC, those cities and the chamber all meet weekly on a call to discuss resources, ways that we can collaborate. And our Carlsbad chamber folks were the ones that put together the first survey that went out, and that information has been really helpful, both for our city, but also for what's going on in all the North County cities. The San Diego Regional EDC and the consortium are doing a survey of businesses in the entire region. We've had the pleasure of doing these joint communications with the chamber and the CVA. Hopefully you've seen them. We are on number 5, and that's been a great resource to provide information that is directly associated with what's happening and necessary for businesses to know. One thing that we kept on hearing from companies was that there was so much information, and in some ways you could say noise and information overload, that it was difficult to know what actually mattered to a company, and especially one in Carlsbad. And so that's where we developed this idea of the joint communications between the chamber and the CDA. If you have not been receiving those, please send us an email, business@carlsbadca.gov, and we will get you on that list and you will receive those communications. A lot of one-on-one business consultation has been occurring. 60+ companies have been engaging with us, where we're connecting them with resources or helping them work through the questions around whether they're an essential business or not. And then we consistently are distributing information regarding the federal assistance programs that you're probably very familiar with. What do we hear from a lot of these businesses? Well, initially there was a lot of questions around, are we essential versus non-essential? Can we stay open? And we fielded a lot of those questions. I know the chamber fielded a lot of those questions. Those numbers have begun to drop off a bit. But if there's any question that you have regarding this, regarding your operations, please contact us. There is a weekly teleconference from the county for the business sector. If you don't have the information regarding that, we can provide that as well. And that has been really useful in understanding what the public health orders mean for businesses. But then somebody just unmuted themselves, and I'm hearing myself, my gorgeous voice in there. There we go. That's better. All right. It's been very useful to clarify certain questions there, but we also have other avenues to clarify essential versus non-essential businesses. We also heard from a number of businesses that they were interested and had questions about a moratorium on evictions during the COVID crisis. I'll report that on Tuesday, the City Council voted to temporarily suspend in the City of Carlsbad evictions, consistent with the governor's order with regards to that during the crisis. An important fact, although we know that post-crisis and the lifting of that moratorium, there still will need to be work that occurs between landlords and tenants on how to deal with that suspension and the rent payments associated with that. And then finally, a lot of questions regarding what relief programs are out there. Let's mention a couple of those. So, and I'm not going to get deep in this because I know many of you are familiar with it, but lots of questions regarding the Paycheck Protection Program, the new program that was authorized under the CARES Act, and then the Economic Injury and Disaster Loan Program, which has been in existence for quite some time, administered by the Small Business Association, but now has been expanded with additional resources. One thing to note, which I think you all know, is that one is administered by qualified financial institutions like banks. The other is Small Business Administration. So we've been fielding a lot of questions about how to get involved with, especially the PPP program, because it's not being administered directly by the SBA. So what's out there for businesses? Many different things, and I'll just say, as much as we're trying, we know that there are gaps, and there are informational resources and also financial resources, but none of that is going to fully alleviate the serious impacts that are happening right now. I mean, my dad is a small business owner, has been for many years. I worked for him initially when I was a kid. You know, he's struggling with this. I know all of you are struggling with this, and we're doing what we can. So please contact us if there's anything that we can do to help you out, or questions that you have. One thing that we're going to do next week to continue this sort of engagement is go here. We'd like to do a all hands, all businesses Zoom call so we can field your questions and begin bringing in more data. We're going to launch a second survey with our Carlsbad businesses next week to get information regarding your thoughts on disaster and disaster response, and ultimately the goals of what we're doing during the disaster response and then recovery and hopefully into stabilization is connect all of you with existing resources, support you during the response, at the same time ensuring that the core services and fiscal health of the city stay strong. And David Harrison is absolutely phenomenal, the best in the business when it comes to the disaster response. And I can tell you that going all the way back to probably December, January timeframe, he started getting our city leaders and members of the community an understanding of the potentials around, you know, pandemics, et cetera. No city I know in the entire state was doing it at that time. And so we're incredibly fortunate to have him as the center point for our response here. And we're very fortunate to have all of you because this sort of connection between the community, businesses, and cities is not something you find in many communities. And it really will lead us through both the disaster response into the recovery and beyond. And so the final part of the goals of this engagement is to strategically engage during the expected economic downturn. I think about this, I went through the Great Recession working for a city and doing economic development work. And it was a very difficult time. This is like that on fast forward. It's very, very difficult for us to understand what the ramifications to the economy will be like yet, because it's happened so quickly. There was a lot better modeling around what was happening with the recession because of the length of time that it took. But as we continue through the crisis, we will be better understanding what the actual downturn is going to look like, how long that potentially could last, and how best the city can support our businesses to get us through. So Tuesday, I'll ask the chamber folks to push out information regarding this Zoom call for Tuesday. We'll be launching that survey on Monday. And then if there's anything we can do for you, please send us an email at business@carlsbadca.gov. In my team, we are data nerds, so we are collecting all that information and reporting that out to the EOC. David showed you some of those tools, but we're providing that information. And the more the contacts we get from you, the more information we get from you, the better visibility we have on how we can support our businesses. And with that, thank you so much for the time. And it is really a pleasure to have such a great partner in the chamber, such a great partner in all of you. And Carolina's on mute. There you go.
Hi. Thank you so much, David, for all that information. I can tell you that one of the reasons why we continue to stay engaged with our members and our members keep reaching out to us is because of all that work that we are doing for that community. So thank you for this information. And of course, please send us everything for the Tuesday call. And now we have Dr. Thomas Coleman with San Diego County, who is going to talk to us. We're very lucky and very honored that we're able to have a doctor right now available for us. Just to give you a little background on Dr. Thomas Coleman, he's the medical director for Maternal and Family Health services at the County of San Diego.
We're getting feedback on.
Okay, let me, hold on. Give me 1 second. I'll get rid of that. Okay, better? Is that better? Can you guys hear me?
Yeah.
Okay. Okay, let me finish the intro and then I'll mute myself again. Well, Dr. Coleman has more than 20 years of diverse experience as a physician, public health officer, executive, and epidemiologist. He's a graduate of the University of North Carolina Schools of Medicine and Public Health and the UCSD SU General Preventative Medicine Residency Program, where he served as a chief resident. He is board certified in public health and general preventative medicine. So in case there's any doubt, we have the right person here. So let me see how can we deal with that feedback. I'm gonna go ahead and unmute myself and leave the mic open for Dr. Coleman.
Ask David Graham to unshare his screen because it's full screen.
Yes, David, can you unshare your screen?
Great, thank you.
Thank you.
Now it looks like I'm unmuted. Good morning, everyone. Can you hear me?
Yep.
Okay, great. Thank you for the opportunity, Carolina. I was catching the end of what David had said, and it's an interesting time for all of us, and I want to recognize, you know, the uncertainty for everyone. It's uncertain times. You know, I think the take-home message is we'll all get through it together. I want to update you on sort of where we are in terms of the pandemic and then some particular things related to the business community. But when David was talking about the Great Recession, I was actually at that point the local health officer in the Daytona Beach area in Florida, and I had a lot of preparedness experience in terms of dealing with hurricanes and even wildfires and flooding and even our infectious disease outbreaks. But obviously, you know, a pandemic of this magnitude is a life-changing experience for all of us. So we still have challenges ahead, but we'll all get through it together. Globally, the novel coronavirus, which causes COVID-19 infections, has resulted in over 1.5 million cases and almost 95,000 deaths. Nationwide, there are 454,000 plus positive cases, and as of yesterday, 16,267 deaths. And I know that you all know that the U.S. has taken the lead of all countries currently with the greatest number of cases and deaths. In California, there are 19,131 positive cases and 507 deaths. And as of yesterday, what's most pertinent to us in terms of the county, we had 1,628 positive cases, including tragically 40 deaths, which was an increase of 4 deaths from the day before. Sort of some of the demographics of the cases, of the 1,628 cases, 858 or almost 53% are between the ages of 20 and 49. That's definitely pertinent to the business sector as, you know, people in that age are entering early adulthood until 49 still. I guess when I was younger, it was middle age, but it's not middle age now. And especially as I get older, it's not middle age. 790 or 48.5% were female, 832 or 51.1% were male of those 1,628 cases. It's interesting because over time, that's begun to balance out for the first period of what we were seeing in terms of testing and positive cases. There was predominance of males, but it's beginning to balance out. Although there is evidence nationwide that males tend to be affected more profoundly with the virus than females. Not really exactly sure why that's the case, because I don't think there's any type of gender reason for that. Of the 1,628 cases, 348 or 21.4% have been hospitalized. And of that subset that have been hospitalized, 132 of them, which is about a third of the hospitalized cases, have been admitted to the intensive care unit. Overall, that's about 8% of the 1,628 cases. And unfortunately, 40%, as I mentioned, or 2.5% of the total number of cases have died. And when you look at sort of those demographics across the board of what we've seen elsewhere, I think they're pretty analogous to other jurisdictions, certainly within the county, within the country. And most importantly, I want to send my sincere condolences to families and loved ones of the cases that have died. You know, all these numbers, especially when you look at globally over 1.5 million, these numbers are almost unfathomable. But behind every number is a person and a family and, you know, friends. So we truly are all sincerely sorry about that. April is a critical month for us, and we'll get into the amended health officer orders. There's been a huge focus since the county declared an emergency on Valentine's Day, the middle of February, on social and physical distancing. If you have followed the health officer's orders over time, more and more restrictions have been placed in terms of that. Even though what has been conveyed nationally that California is doing better than a lot of other places, still with these tragic numbers, we know there's work to do. And this is especially a time when we certainly can't let our guard down. We anticipate, unfortunately, that all of these numbers will continue to go up this month as far as cases, hospitalizations, and deaths. But that's the efforts in terms of social and physical distancing are very important as far as flattening the epidemiologic curve. So that's to make sure that any diseases that we can prevent, any instance of this, because the Centers for Disease Control just sort of changed basically that everyone now has at least some risk. We know that certain groups have higher risk than others, the elderly, people with chronic conditions, people with immunosuppressive conditions, and so forth. But there's been increasing evidence that asymptomatic or pre-symptomatic spread can occur. And so even last night, about 9:30, there was a new California Health Network that went out to all the physicians in the community, a message sort of updating that. So because of that, that can be very unsettling and scary, but it just reinforces the need to continue the social distancing that we've done. The other side of that is continuing to work with our healthcare system to make sure that it's amplified as best as it can be to take care of people when they become sick. And there's been enormous efforts ongoing that continue to go on. There's a weekly call with the county and all the hospital CEOs. There's a weekly call with all of the health system chief medical officers, and Dr. Nikki Pentiti is our chief medical officer. There's a weekly call with chief nursing officer, Dr. Denise Foster, and all of the nursing leadership within the county. And, we're continuing to provide supplies and work with the healthcare partners in terms of that. So that's sort of the overview. Let me get into the health officer orders, because some of them just changed literally this week. Probably the most important thing I can tell you is all of this information in terms of the demographics and everything else is on a website that the county has established. It is www.coronavirus-sd.com. And so that's where all of the information is related to this, related to all the orders, related to guidance either from the county or the Centers for Disease Control and Prevention or the California Department of Public Health. But the latest iteration of the health officer order that were amended this week and that will be continuing at least until April 30th, sort of restricted more in terms that right now all gatherings are prohibited. And what that basically means is any public gathering, outside of your own family situation would no longer be allowed at this point. And we all know that with this being a holiday weekend, that, appropriately causes consternation. We just need to make sure that we are virtually connecting with people. And it still certainly is fine for families to go out, but in terms of broader gatherings, they're prohibited. It was effective on midnight Tuesday. All essential businesses that allow members of the public to enter a facility must prepare and post a social distancing and sanitation protocol. There's a link to that, I think directly when you go to the homepage of the coronavirus-sd.com website. That has to be prepared and posted at or near the entrance of all applicable facilities. A copy of this must also be provided, thank you, to each employer performing work in the applicable facility. So you can see here on the coronavirus website, the focus on staying home except for essential needs, the social distancing plan template that is also in Spanish, and then other resources. Again, this is our repository of everything. You'll also see the text message there that you can text to COSD space COVID-19 to that number to get regular updates texting as well. The other change related to the health officer's orders are effective yesterday at midnight. Businesses that sell food and or beverages, so for example, grocery stores, convenience stores, farmers markets, supermarkets, and so forth, must have a current permit to sell food and or beverages from the county's Department of Environmental Health to be deemed essential. So again, there's 6 components to the social distancing and sanitation protocol. It's hopefully relatively self-explanatory. I'll certainly answer any questions once they get through. The other change that occurred, and it's applicable to all of us, but particularly to certain businesses, on April 1st, California, through the governor, issued a recommendation for everyone that goes out, and nobody should be going out at this point unless it's essential needs, so out of their homes, to wear a face covering. And it's purposely called a face covering and not a mask. It's not meant to be a surgical mask. It's certainly not meant to be an N95 respirator. Those are more, we're trying to make sure are kept protected for the healthcare arena in terms of personal protective equipment. But everyone should wear a face covering when they go out in public. In terms of that, that is a strong recommendation, but it's not a legal requirement. However, all employees working initially there were 5 subsectors, if you will: pharmacies, grocery stores, convenience stores, gas stations, and restaurants are required to wear a face covering. And it's the employer's responsibility to make sure that they are doing so. Effective next Tuesday at midnight on April 14th, this will also apply to employees working within banks and public transportation. So for example, taxis and ride shares such as Uber and Lyft. So again, it's a strong recommendation for everybody to wear a face covering when they go out in public, but in certain business sectors, it's an overt legal requirement that is enforceable in terms of that. So as I mentioned, we all have an important role to play this month to flatten the curve, continue healthy hygiene, sanitation, and disinfection, stay home and self-isolate. If you become sick, about 80% of people with COVID-19 have mild or moderate symptoms. We would want them, if they are concerned, to contact their own personal healthcare provider. If for whatever reason people don't have a healthcare provider, they can connect with 211 San Diego. There's a nurse triage team that's been established through the county to answer questions related to that. but we also want to make sure, because we've seen sort of a downturn, and even nationally, sort of fewer heart attacks and strokes, and we don't know if people are just not presenting to the emergency room, or if they're scared to go to the emergency room, because of the specter of COVID-19. So the other side of that, we would certainly want to encourage you, your employees, your family members, if you feel like you are seriously ill, do not hesitate to go to the emergency room. So severe shortness of breath, high fever, chest pain, other more significant medical symptoms, we want to make sure that people would take the appropriate actions in terms of that. The final two things I'd like to stress, and then I'll try to answer any questions. There's a daily press briefing, including the weekend, that's at 2:30. They tend to go anywhere about 45 minutes. That's a great source, even from me internal to the county, of making sure that I know exactly what's going on a daily basis. So that's great information. And I think, again, really reinforcing, the uncertainty, the stress, the specter of all of this, seeing the media, seeing the tragedy of all of this, all of us will respond to this in different ways from a trauma-informed perspective. And so really stressing the mental health aspect. There's actually a separate page with resources related to mental health on the website that Carolina had pulled up. And also make sure that that there's access and crisis line through the county that operates 24/7. It's in 150 languages with immediate interpretation capabilities. And the number for that is 888-724-7240 if you need any support. So to reinforce, practice healthy habits, call family and friends to connect with them. And what Supervisor Cox says at the end of the press briefings, I will reinforce: live well and stay well, and to stay well, stay home. And then Dr. McDonald, our medical director for epidemiology, has sort of coined, if you leave your place, cover your face. So those are the two messages I would want to leave you with. We're all a community. We will get through this together. It's still critically important for the remainder of this month to try to maintain strict physical distancing, but also to make sure that we're connected virtually, just like with this and others, with family and friends. So with that, I will be happy to try to answer any questions that you have.
Yeah, Dr. Coleman, thank you so much for that very informative presentation. And you have my email, so whatever resources that you've spoken about today, you want to send those over to me. We'll be happy to disseminate those within our business community for sure. There is one question for you. It comes from Josh Mazer, and he would like to know if you could offer an update on testing and availability, including antibody tests.
Great question. I think that's sort of been on everybody's mind. The reality of it has been that testing has been challenging, although San Diego County, for all of us, not just the county, but now that we have broader testing capabilities per capita, San Diego has done better than any other county in California. So as challenging as it has been, there's been progress. You will see if you go to the coronavirus-SD website, it's actually tracked. There's a lot of graphical information now where you see the number of tests that have been done. I don't readily have it right off the top of my head, but I want to say it's approaching 20,000 probably within the entire county, and about 93% of the tests are negative. So initially, it was very much focused just on our public health laboratory at our main headquarters in Rosecrans. And first of all, to reinforce, all testing needs to be ordered by a physician or the healthcare provider. So the county doesn't order the testing. What happened initially was, because of the limitations nationally of both the testing kits, the reagents, even the swabs to be able to do the test. It was challenging, and it was very much focused on a very limited subset of people that either had known exposure to a case or were hospitalized or had travel exposure. It's been broadened somewhat, but it's still focused on high-risk categories from that perspective that I mentioned earlier, some of those as far as elderly, immunosuppressive conditions, chronic disease, a particular focus on congregate living settings. We've unfortunately seen outbreaks in terms of skilled nursing facilities and other congregate care facilities. But more broadly, in terms of testing now, the county still has a capability. It's continuing to amplify its capability as far as doing more tests. There are either 6 or 7 healthcare systems that are now doing testing in terms of that. And then finally, there are at least 4 commercial laboratories that are doing it as well. So we're continuing to expand testing capability, although even at this point, we do not feel that everybody needs to have a test. I mentioned that it's about 80% of people that have mild and moderate symptoms and that they can self-isolate. Again, if there's a question about needing to be tested, a person should contact their own healthcare provider. In terms of the, sort of more of the novel aspects as far as antibody tests, more to come. That's been the challenge for all of us, is that we try to provide the best guidance we can. We follow the guidance, from what comes from CDC and the California Department of Public Health, but as things evolve, the guidance changes. At this point, I don't really see a huge focus, but this could change as we learn more on the antibody tests in terms of diagnosing someone with having COVID-19, because from a medical perspective, you would not begin to see the antibodies, and this is going to be too much medical, but just to help you understand, the antibody tests right now are IgG, immunoglobulin G, and that tends to occur as far as development after any type of infection, after immunoglobulin M occurs. So my point is, it's more downstream after the infection has occurred before you start seeing these antibodies. So I don't know that it will have a great aspect in terms of diagnosing, but as we get more toward recovery, it certainly may have a role in terms of people that are immune. It may begin to play a part in terms of helping us know who can safely go back to work at what certain time. There's also, you may have seen the aspect of plasma donations, people that are immune of, and there's even things percolating within all the healthcare systems, and the county will probably be trying to coordinate some efforts with that as far as plasma donations. And so those antibody tests may be important in knowing who would be applicable to donate plasma that conceivably could be used either to prevent or help manage someone with a case. So that's sort of the current overview of all the aspects of testing, still through the public health lab of the county, multiple healthcare systems, at least 4 commercial entities that are doing testing now. We all know the need for more testing and are trying to continue to expand that. So that's a great question.
Thank you so much, Dr. Coleman. There was another more question that came in from Josh. I unfortunately have to move over to Robert Mielish here with the Department of Homeland Security. We hope you can stick around, but we will understand if you have to leave. We'll make sure we get Josh's question to you. It's currently on our chat room. If you want to answer to him directly, before you log off, that'd be great. So now I'm going to turn it over to Bob Mielish. He's with the Department of Homeland Security, and he's just going to give you a little brief on critical infrastructure and all that fun stuff. So let's get you guys with Robert. I'm unmuting you right now, Robert.
All right. Thank you, everyone. Thank you, Carolina. I appreciate it. It's a pleasure to meet with everybody this morning under these tough times. Over the years, we've done this type of exercise, and what's interesting to me is we always start about 9 in the morning with some meet and greet and some coffee and donuts. At 10 o'clock, we get into the meat of it, and by 11 or 12, we've got it solved, and we were victorious, and we have lessons learned. And this is, I think, day 30 or 40. I don't know. David's probably keeping track, but it's very interesting to us. So what I have this morning is I have a presentation that I've put together. I want to kind of run through it. It's going to be available to you afterwards. It's got a ton of information. Earlier, someone was talking about the noise of information and the paralysis by analysis that we have. So I'm going to give you a whole bunch of stuff that hopefully you can lift through at your leisure. And we can do that. So for those of you that don't know me and know what I do is I do work for the U.S. Department of Homeland Security. I'm in a voluntary program called the Protective Security Advisor Program. I work for Cybersecurity Infrastructure Security Agency. Our role really in CISA is to understand critical infrastructure, its dependencies and interdependencies. And we really try to work to make sure that things keep moving and that when you turn the light switch on, the lights come on. When you turn the faucet, the water comes on and that water is clean. When you go to the grocery store, that things actually show up when you want them. So that's kind of the world that we work in. I am a person on a two-person team. I have a colleague, Nikki Phelps. Maybe you've met her. Together, she and I cover the San Diego, San Bernardino, Orange, Riverside, and San Diego County. So our district's pretty big, but we do work with all the critical infrastructure. So I don't know if you guys can see the presentation or not.
Let me see. Let me just
okay.
pull it up. Give me one second. Sure. It's right here. All right, I'll be sharing. All right. Can you guys see it? Can you see it, Robert?
Yes, I can see it.
Perfect.
Yep.
Can everybody see it? Okay. Just give me a thumbs up on the chat room. Awesome.
So if we can slide down to the second slide,
Yeah.
I'll kind of go through that just a little bit. So what Nikki and I are doing with our colleagues in Arizona, New York, all across the nation, we're really working to unstick the roadblocks, right? So we understand that during these tough times, there are some roadblocks that the public and private sector entities are coming into contact with, whether that's essential workers guidance, which you should have seen that already by DHS CISA. We're on version 3 already. We keep learning information and learning best practices that we're trying to adjust that. It's interesting that what we thought was essential as a society may not be so essential. Earlier, I heard a comment about IT. We can do without, lights, or we can do without something else. But man, we really need to have IT. And when we follow that thread, there are so many other things that become essential, right? So in Arizona, we found that when schools shut down, IT became compromised because we didn't realize that, or sometimes our IT providers use schools as places to put a point of presence, a POP site. So when the school lost power, the POP site went down and degraded communications. Some of the other things that we're working on is PPE prioritization. The big effort has been on the health and medical fields right now, but we realize that workers in a warehouse need PPE. We recognize that our electric industry needs PPE. Our water and wastewater operators need PPE. And what was happening is these other sectors weren't getting the appropriate personal protective equipment that they needed. So we're trying to release some guidance that can go to the vendors so they can understand that these other folks are indeed priority. Do they need that surgical mask? Probably not, but we're working with them to understand their needs and then, giving the vendors some guidance on how to generate and distribute that equipment. We're also working a lot in the supply chain, trying to make sure that things keep moving. Our supply chain, many of you understand, is somewhat challenged, especially if you're trying to find paper products. We heard yesterday that the supply chain is working and products are moving, but as soon as they hit the shelves, they evaporate. So we're really trying to dig deep with our national coalition and our other partnerships with FEMA to really try to dig into that. And again, the dependency and interdependency. Some of the things that we're interested in hearing about from you guys are what your challenges is. We're really looking to understand what the impacts of COVID-19 are on you and the business, on your personnel, your commodities. We're really trying to get everyone to think 30, 60, 90 days, right? When we talk to folks, they say, oh yeah, hey, I'm good today, but we really want to know what this is going to look like for you in 30, 60, and 90 days, assuming that we continue in this current posture. So if we can slide to the next slide. What we wanted to show you here is our CISA Insights page. At the top, you'll see the URL. It's hyperlinked in the presentation that we hope you can get receiving your email a little later on. But what I want to point out is if you go to that URL on the left-hand side, you'll see the arrow that says CISA Insights. And then I'm going to point out the risk management for the novel coronavirus. What we did is we put together some what we thought were important thoughts. And on the next page, the next slide, we'll show you what that looks like. So you can download this, but it talks about how to think about coronavirus from a risk management position. And we really do it in a couple veins. We want you to think about it from the business. We want you to think about it from your IT. We want you to think about it from your vendors, your supply chain, upstream, downstream. Basically, this really takes a different look at business continuity. And we really just wanted that to be available for you. You can see down at the very bottom, I gave you a URL directly to that. What we hope it is, it turns out to be, is a great discussion guide amongst the executive management team that you can really have a heartfelt discussion and an honest discussion about your company's capabilities, your preparedness, how you're thinking about things. So the other thing I want to show you is on the next slide. I would like to point out the CISA worker essential critical infrastructure workers guidance. As I mentioned earlier, it's on version 3 now, but you can always come to this page and get the most updated version. This really helps identify those folks that we think are critical. When we started out in this coronavirus, we said, hey, there's only folks that are really critical. And I think even David mentioned that over time that thinking has evolved. And one of the things that we did not think about early on was the truck drivers, those guys driving the big rigs. We didn't even think about those. Those are somewhat ubiquitous. They're all over the place, and stuff just happens. Well, we've had to realize that they are critical. They're the ones moving boxes from the warehouse, all those things that we need, the masks, the paper towels, the paper products, the food. Well, they're getting there via this road transportation, and these drivers are crossing state lines. So we had to have some kind of coordination in between state lines. And then we have to have a way to feed them and fuel them. So they are indeed critical infrastructure. Folks, we weren't really thinking that at first. So as we evolve, so does the document. So if we can move to the next slide. What we wanted to do was to also point out to you that CISA collaborated with the CDC to develop interim guidance for exposed workers. We know that folks are perhaps have been exposed and have recovered. We know that folks are in areas that they can get exposed. So we wanted to leverage the CDC to provide guidance. So that guidance is right there on that page. It was released yesterday, so it's fairly new. On the upper right, I wanted to point out that we've already translated into a couple of different languages. So if you work with a diverse group of folks in your business, it's already translated, and you can download it into PDF form. If we can move to the next slide. What I wanted to do is talk to you a little bit about cybersecurity. Now, those of you that know me know I am not a cybersecurity expert. I spent all night studying, and I learned how to spell IT. And that's the extent of my knowledge of cybersecurity. But what we want to do is let you know that during the COVID-19, there are opportunists out there who are trying to take advantage of you, and they recognize that you are extremely dependent on your email, on your electronic systems, on your VPNs. Some may be more secure than others. We wanted you to understand that there are some email threats. There are threats with different sharing platforms. So what I've done on this page is I've kind of outlined the latest advisory. We partnered with the United Kingdom because they had some information about advanced persistent threats. The guidance is hyperlinked on those pages, so all you have to do is click on the orange. I apologize, it's not blue, it's just the way it worked in PowerPoint for me. It wouldn't go blue, so those oranges are hyperlinks, so it'll take you directly to the National Cybersecurity Center. So what we can do is slide on to the next page. I wanted to give you a ton of resources that you can reach at your own. You can see there I gave you the Cyber Essentials page. That is going to have a ton of information. Everything that CISA knows about cybersecurity is going to take you to the United States Computer Emergency Response Team, known as USCERT. It's going to take you to the Industrial Control System. Those are those folks that have chemicals under pressure, automation, things that they manage remotely. We wanted to give you the FBI's guidance for defending against video teleconference hijacking. So that's out there. And I also wanted to point out to you the very last bullet there is the National Vulnerabilities Database. A lot of times I'm not sure that folks know where to find vulnerabilities on their systems. Sometimes, we get things through the email, maybe our vendor sends us something. So if you go to the nvd.nist.gov, if you play around with that, and I'll tell you, you got to do an Easter egg hunt, you'll be able to go through there. And what I ask you to do is to take all the equipment that's networked that you have on your network and just plug it in. So if you have a you name it router, or you name it computer, or you name it VLAN, and put that the name of that device in there and see what comes up. I will use an example without naming company names of a particular doorbell or a particular camera. You can run it in there. It'll show you what the vulnerability is. It will also give you mitigation. So we thought that was going to be very important for you in these times. So if we can slide to the next slide. What I wanted to show you here was the Cyber Essentials page that I talked about earlier. We kind of break some information down for the person, the staff, the system, the surrounding, how to handle your data. There's a ton of stuff on that page, and I gave you the hyperlink to it. So feel free to use this later, explore it, mouse around if you will, and find the information that you need. If we'll move on to the next page, what I wanted to show you here is something that I think you guys will find useful. It's the National Business EOC. It's a partnership between CISA and FEMA. We have bi-weekly calls. This is our dashboard that you can look at. I'm pointing on the red arrow up to the call-in information. I want you to know that you have to stay connected to the page. The call numbers change. Initially, we started out and said, hey, folks, call in on these days and use this number. But that hasn't really worked out. So what's happened is that they changed the number, they changed the date and the time. So stay connected to the page. What I want you to know about this page is that there's a chat function. There's always people interacting on there. You can find somebody from Target, Walmart. You can find somebody from Maryland. You can find somebody from Chicago. There's always some business entity doing some work on there. And you can always reach someone from FEMA and CISA. There are downloadables on this page. So if you're looking for some sort of information, you want to know where to find something, you want to find an order, you want to find some guidance, it's pretty much on this page. While I'm here, I also wanted to tell you, and I will send this information out a little bit later, yesterday we had our very first Western States Business EOC call. We had everybody from Arizona, Nevada, California, Washington, and Oregon on. So the private sector entities, we heard from grocers and supply chain folks like Amazon yesterday. So I will try to get that information out to you so that you can participate and get your voice heard. The one thing I do want to underscore about the National Business EOC is that you are able to have your voice heard. You can get onto the conference call, and if you have a concern, you can bring that up. That chat box, somebody answers it. And it's a kind of a business-to-business answer, but it's also a way for you to get to the government as well. So it's a great resource. I highly encourage you to make use of it. So if we can slide to the next one, what I wanted to do is just kind of wind this out with some things that you may or may not know about. If you have a donation or you wish to sell to the government for COVID-19, whether you have medical supplies or medical equipment that you wish to give, hey, there's a URL that you can go to. that will take you directly to somebody who can handle that. If you're in the business and you have things that you wish that you can retool, or you have supplies that you want to sell to the government that you don't wish to donate, and there's another URL right there for you. So just another way that you can get into it. And we'll slide to the next slide. The next one is really about production. So if you're a company that wants to retool, much like our automotive industry did, there's a place for you to go. And if you have critical medical supply needs, we tell you that you need to go to your local public health or emergency management. David is a great place to start right there. If you have something you need, work through him. He'll work through San Diego County, and it will get bubbled up. For non-emergency, non-medical needs, there's a private sector industry liaison program. So I wanted you to know about that. And having said that, that's pretty much my brief, real quick, real easy. I just wanted to make sure that we gave you a ton of information. If there's anything that my colleague Nikki or I can ever do for you, please reach out. And thank you.
Thank you so much, Bob. Everybody's been asking me via chat if we are going to share these slides, and I've told them yes. So, you know, once we get off the call, just give me a little bit before I can get everything together and distribute that for everyone. I don't know if anybody else has any more questions. I know that there have been some questions being answered via chat, but if somebody has a question right now, please let me know for any of our presenters. We have about 5 more minutes, so let me know.
Hey, Carolina.
Yes.
Hi. It's
Hi.
really for all of our presenters. Any thinking about recovery and what it might even look like as we, or not even when, but what it might look like to reintegrate ourselves. And, you know, we're getting questions from others too.
Yes, if anybody wants to take that, maybe David Harrison. Sorry to put you on the spot.
No. I think it's important to understand that the city's policy group leadership team is looking at that. We're looking at projections, but as David Graham alluded to, there is a lot of unknowns still associated with incident, and we certainly, you've heard it in the press, we want to do it here. We will do it here in the city, as we want to make sure that we have data-driven decisions, data-driven analysis, but absolutely the policy group members and those members of city leadership that you'd expect to be involved in this are involved in this. If David Graham's still on, he might care to talk a little bit more about the specifics of how and or who's involved in some of this decision making. It's a little bit more of his area of focus, but it's something that the city's policy group and leadership team has been discussing and is discussing on a daily basis. So David?
Sure, and are you thinking like specifically as it relates to businesses, David? Is that what you're kind of focused on as far as recovery? Oh, you put yourself on mute. So I assume that the answer is yes. Go ahead.
It was Dr. Sarah Gilman's question. So Sarah, you want to rephrase your question for David?
Well, David, just all the, you know, the insights of what are we looking at business-wise, but, you know, all of our business owners have families and school-age children, and, you know, it's really a community unfolding as we look at all of that. Thanks, David.
Yeah, so I'll address the business part first. I mean, that's why, as I had mentioned, it's so important that we hear from all of you as to what specifically you all need as we move into recovery and connecting folks with those sorts of resources. From the city manager, the city council, across our departments, particularly admin services, the economic development folks, we're looking at first trying to assess what the damage is and when there might be a bright spot. And that helps to guide what's happening with the recovery. A lot of this is still, as David would tell you, led from the state and the county as far as the public health orders. And so I don't know that we can see just yet exactly where recovery begins. But from a leadership and policy perspective, That's exactly what we're already beginning to kind of plan for. So how do we reintegrate when social distancing ends? You know, we know that the schools have already kind of pushed things off into the summer. And so I think what would be really helpful is ideas that all of us have that go beyond just the disaster response into the recovery. And I would say with where we stand right now, we don't know exactly when that time is, but we're already beginning to work on ideas for how to, you know, more rapidly get back to normal, while at the same time making sure that we don't, you know, create a resurgence of the issues that we've seen to date. Hopefully that helps, but go ahead.
One thing I wanted to throw out there of lessons learned from some mass casualties in communities, whether it was San Bernardino, Vegas, and you know, there was an end to that incident. Obviously, this is a little different, but in terms of returning to work and returning to life, what we found is a lot of employees quit. A lot were moving to something else. There was a lot of psychological resilience damage, and that what we learned is we should have gotten in there sooner to begin to rebuild the stress, you know, recovery from a psychological and team perspective. So we can talk more, David, later about that and some things that we learned and how any of us with our various expertise can come together to really create something to help people in it's going to be a while, you know, the recovery process.
Yeah.
And Sarah, if that outreach hasn't occurred, please let me know, because I know it's been discussed specifically.
Okay, I haven't heard it yet.
I'm
all ears. I'm all ears.
I'm a bit surprised. As I said, it's something we recognize is extremely important, and it goes into beyond employee assistance programs and to exactly the topics you were talking about. It's been a part of the discussion, so I'm sure it's a work in progress to reach out to ensure that that type of support is being provided. It's been discussed.
Yeah, and I think we can create something to have it, sort of the readiness of it. We will have something put together. I'd be happy to help with that.
Thank you.
Thank you so much. I had a last question here also from Leila for Bob Mielish. What is being done to secure the IT backbone, especially for supporting critical infrastructure, first responder networks, central stations, dispatch, operations center, utilities, etc.? And that will be our last question.
So that's a very good question. There is a lot of work happening on the backbone with the different private sector entities. AT&T's FirstNet, Verizon is doing a lot of work. A lot of our regulating entities are working with the providers. Our cybersecurity advisors, whom you may have met, are doing a lot of work with them. So, you know, CISA is providing free assessments and advice. The companies are doing what they do very best. They know how to secure it. And I think collectively across the public-private sector collaboration that we have, we're doing everything that we can to make sure that these systems are secure and kept within standards. I hope that helps.
Yeah. Well, thank you so much, everyone. This has been incredible. Not only just touching base with all of you, but all the information here is something that we can all take to our own businesses and to our own lives. So it is a privilege for me to be able to work with all of you and help put together these virtual meetings. If you have any questions, you all have my email. Please reach out. We're asking all our members to continue to stay engaged because you know, our leaders won't know what we need if we don't tell them. You know, we have to speak up. We have to make sure that we know and that they know what is needed. So thank you very much. I mean, I'm happy to, this concludes our presentation, but if you guys want to stick around for a couple of minutes, maybe just to touch base, I'm happy to keep these open for you guys to chat for a bit. Thank you.